This eye ointment is used to relieve dry, irritated eyes caused by various factors such as wind, sun, heating/air conditioning, computer use/reading, and certain medications. It contains ingredients like carboxymethylcellulose, dextran, glycerin, hypromellose, polyethylene glycol 400, PEG 400, polysorbate, polyvinyl alcohol, povidone, or propylene glycol, among others. Eye lubricants keep the eye moist, help to protect the eye from injury and infection, and decrease symptoms of dry eyes such as burning, itching, and feeling as if something is in the eye. It is recommended to use this ointment before bed for the best results. When using overnight lubricating eye ointment, follow the directions on the package. If you have questions, ask your doctor or pharmacist. Do not use if the solution has changed color or is cloudy, but some brands may have a milky appearance, which is okay as long as the solution does not change color. Some eye drops need to be shaken before use, so check the label for instructions. Eye drops can be used as often as needed, while ointments are typically used 1 to 2 times daily as needed. If using an ointment once a day, it may be best to use it at bedtime. To apply eye ointment or drops, wash your hands first and be careful not to touch the dropper or top of the ointment tube. Tilt your head back, look up, and pull down the lower eyelid to make a pouch. For drops, place the dropper directly over the eye and squeeze out 1 or 2 drops as needed. For ointments, hold the tube directly over the eye and gently squeeze a small strip into the pouch. Close your eye and roll it in all directions to spread the medication. Blot away any extra ointment from around the eye with a clean tissue. If you are using another kind of eye medication, wait at least 5 minutes before applying other medications. Use eye drops before eye ointments. If you wear contact lenses, remove them before using most kinds of eye lubricants, but there are some types that can be used while wearing contact lenses. Check the package for instructions. Tell your doctor if your condition lasts or gets worse after 3 days. When you first start using this overnight lubricating eye ointment, you may experience temporary blurred vision. You may also feel a minor burning, stinging, or irritation in your eyes. If these effects persist or worsen, it's important to contact your doctor or pharmacist. If your doctor has prescribed this medication for you, it's because they have determined that the benefits outweigh the risk of potential side effects. Most people who use this medication do not experience serious side effects. However, if you do experience any serious side effects such as eye pain, change in vision, or continued redness/irritation in your eyes, it's important to seek medical help right away. Additionally, if you notice symptoms of a serious allergic reaction like rash, itching/swelling, severe dizziness, or trouble breathing, you should also seek immediate medical attention. It's important to note that this is not a complete list of possible side effects, so if you experience any other effects not listed here, it's best to contact your doctor or pharmacist. In the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using overnight lubricating eye ointment, it's important to check with your doctor or pharmacist if you have any allergies. This product may contain inactive ingredients that could cause allergic reactions. If you have any health issues, make sure to consult with your doctor or pharmacist before using this product. After applying the ointment, your vision may be temporarily blurred. It's important to avoid driving, using machinery, or doing any activities that require clear vision until your vision clears up. It's important to be aware of potential drug interactions when using overnight lubricating eye ointment, as they may change how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist, including prescription and non-prescription drugs, as well as herbal products. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication regimen. If this medication is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms such as passing out or difficulty breathing, it's important to seek emergency medical attention by calling 911. Otherwise, contact a poison control center immediately. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Certain products may contain preservatives that could potentially harm contact lenses or lead to irritation for individuals with allergies. It is important to carefully check the product packaging or consult with a healthcare professional for more information on this matter. This eye ointment is typically used on an as-needed basis. It is applied to the eye before bedtime in order to provide lubrication and moisture overnight. It helps relieve dryness and irritation, providing comfort and support for those with dry eye conditions. The recommended dosage is a small strip of ointment applied to the inside of the lower eyelid before going to sleep. This allows the ointment to gradually dissolve and provide long-lasting relief throughout the night. It is best to use this ointment at night to allow for maximum absorption and effectiveness. Make sure to check the storage information on the package of the overnight lubricating eye ointment. It's important to protect the ointment from freezing. If you're using preservative-free drops that come in single-use vials, you should discard them either immediately after use or up to 12 hours after opening. Be sure to check the product package for specific instructions on when to discard it. If you have any questions about storing your medication, don't hesitate to ask your pharmacist. Remember to keep all medications out of reach of children and pets. It's also important to properly discard this product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper way to dispose of it. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.